Hi there, I'm Stephanie with 9Health. Today we're talking about diabetes prevention because prevention is still important even during this pandemic. You need to take care of your preventive health. Don't forget about taking care of that. Going to your regular doctor's appointments is now something you should be doing, and just getting that baseline of health and making sure that you're the healthiest version of yourself right now. We started offering screenings at Quest Patient Service Center, so you can go there, get a blood chemistry screening at $35 and kind of get that good baseline. But we also just started offering 9Health screenings at home. So there are some screenings you can do from the comfort of your own home. It's pretty cool. You just prick your finger, put some blood on a card, and then you can get a couple screenings done. One of them is hemoglobin A1C, which does assess your diabetes risk. So I want to talk to these two experts today. Liberty Mendeville is with the YMCA of Metro Denver. They have a diabetes prevention program, so I'm going to ask her about that and other diabetes-related questions. And 9Health expert Dr. Pyle Coley, of course, is also joining me. She's a cardiologist, but also an expert on preventive medicine and internal medicine. Thank you both for joining me. Dr. Coley, can you first just talk about what diabetes is for those that don't really know the difference between types and things, and why it's important to know your risk right now?
So diabetes essentially means that your body has trouble regulating its blood sugar. And there's two types of diabetes. Type 1 diabetes or autoimmune diabetes tends to occur when either genetically mediated reasons or you have an autoimmune response where your body attacks your pancreas, which is the organ that makes insulin. Insulin is what really helps to regulate our blood sugar. So that's type 1 diabetes, usually happens either in kids or kind of earlier in life and has a huge genetic component to it. Type 2 diabetes is more lifestyle related and is acquired. It's the much more common type of diabetes, and it can occur later in life. And it usually happens as we get older, but there are a number of other risk factors that we can accumulate for type 2 diabetes, primarily the biggest one being obesity, sedentary lifestyle, excess alcohol use, those types of things. So type 2 diabetes occurs when the body the pancreas has been working overtime for a long time. So essentially what happens is as you start eating more sugar, you're getting bigger, you're not being as active, the pancreas has more trouble releasing the insulin to keep up with how much sugar is in the bloodstream. And so it starts working overtime. And that's called prediabetes. And then if you let the prediabetes go too long, then eventually the pancreas kind of starts to burn out, really just can't regulate that sugar, and you progress to diabetes when your average blood sugar tends to be higher. And then of course, the later stage of type 2 diabetes, you might need insulin because the pancreas is just not making any. And so really what you can do to know whether your blood sugar is normal, whether you're pre-diabetic or whether you're frankly diabetic, because oftentimes it doesn't cause a lot of symptoms, is to get a blood screening test called hemoglobin A1C. That's a test that tells us about your average sugar control over the last 3 months. And with 9Health Fair screenings, you can either get it at a Quest Patient Service Center, or it is one of the tests that you can also get at home. Just prick your finger and get a hemoglobin A1C at home.
Yeah, Dr. Coley just mentioned those offerings that we have now. We had to cancel the spring 9Health fairs, but we are able to offer screenings through Quest Diagnostics at the patient service centers, and like she said, at home as well, which is pretty cool. So I'm going to put the link to our homepage in the comments. You can check that out, sign up for screenings. We also have some free, I wonder why I'm echoing now. We also have some free resources that you can look into as well. One of those is like a diabetes questionnaire, like a free online assessment that you can take. But I wanted to bring in the YMCA of Metro Denver because they have a diabetes prevention program. And Dr. Coley mentioned this a while ago to me, that a lot of hospitals and things have had to cancel some of these preventive programs because, you know, there's just not the resources available for those right now during the COVID pandemic. But Liberty, talk about what the diabetes prevention program is at YMCA and how people get involved with that.
Yeah, so the diabetes prevention program at the YMCA is designed to prevent type 2 diabetes through a set of lifestyle modifications that people can engage in, such as healthy eating, engaging in more physical activity, and eliminating barriers that usually are in the way of trying to eat more healthy and trying to be more physically active. And essentially, people kind of know what to do to eat healthy and how to be physically active, but this program is really that support, that community support, that you're still doing the work, but now you have a group of people and a lifestyle coach that can help you guide you along that journey, and you don't have to do it alone. And anyone can participate in this program if you are pre-diabetic, if you're 18 years or older, if you have a BMI higher than a 25, and if you've never been diagnosed with type 1 or type 2 diabetes in the past. And it's essentially for those who are at risk or have pre-diabetes.
I can put a link as well to more. Go ahead, Dr. Coley.
I was just going to say what's really cool about diabetes prevention and the kind of programs that Liberty is talking about is that you can change the trajectory of the disease just by making those lifestyle changes. So it's not written in stone that you're going to progress to diabetes and your pancreas is going to get burned out. If you find out you're pre-diabetic or have those risk factors like Liberty mentioned, by changing lifestyle, you can completely reverse that process before it gets too late.
That's right.
Yeah, and 9Health is all about prevention, but obviously, you get these blood tests done and maybe you realize you're pre-diabetic or on your way to becoming having type 2 diabetes. So it is nice to have those numbers and know whether you can reverse things, improve things just by changing diet, exercise, those things we all know we should be doing, but sometimes you just need that extra motivation to do it. Dr. Coley, as I mentioned, many places are cutting or unable to offer prevention programs like the YMCA has. Why are programs like this so important?
So part of it is what I said, which is that you can really reverse the trajectory of the disease. So by identifying your risk factors and treating them, you can prevent the onset of diabetes. But the other part of it is that diabetes doesn't act alone. It actually leads to a whole lot of other comorbidities and risk factors, increased risk for heart disease, increased risk for stroke, increased risk for kidney damage, increased risk for damaging other organs, for neuropathy or damage to your nerves. So there's so many other complications that come from diabetes that by preventing the onset of diabetes, it's not just that disease, but actually you're preventing yourself from having a whole lot of potentially other life-changing diseases just by simple lifestyle interventions. And as you pointed out, Stephanie, sometimes it's a little bit of it is not having the time or the resources, and a little bit of it is not having the knowledge. So these types of programs really do empower you because they give you the knowledge of what types of things you can change in your diet, in your lifestyle, with all this coaching to kind of really change the trajectory of your disease. And I always say that food is the best first medicine that anyone should have. And sometimes it could be that you're eating something in your diet that you don't realize maybe, contributing to your hemoglobin A1C going up. So these types of programs can really be fundamental in helping you understand, helping you make a plan, and then helping you implement that plan.
Yeah, and diabetes, I feel like, is one of those things that can kind of sneak up on you as well, especially if you have pre-diabetes and you don't really know yet that you are on your way to having type 2 diabetes. Liberty, can you talk a little bit more about how someone would know they would have type 2 diabetes or at risk, and how and who can participate in the YMCA program? You talked a little bit about this, but do they have to be a member? How do they actually sign up for it?
Yeah, definitely. There are several factors that can place a person at risk for type 2 diabetes, and that includes family history, age, if a woman has ever had gestational diabetes, which is diabetes when you're pregnant. Certain ethnicities place people at risk for type 2 diabetes as well. And then if you're physically inactive or are overweight, those are all risk factors that can place you at risk for type 2 diabetes. But like I said, some of those things can be modifiable with just lifestyle behaviors and changes. And those who can participate in the program, you don't have to be a member. You just have to either be at risk or be pre-diabetic, either through a blood glucose test or an A1C. And that can be done at a 9Health fair, at your doctor's office. And then just make sure to contact one of us at the YMCA to see if you qualify and see if you can benefit from this program.
Yeah, and Liberty mentioned, just get that blood screening done. Again, 9Health is offering the screenings that we normally offer at a 9Health fair, including hemoglobin A1C, through Quest Patient Service Centers, or also 9Health at home, where you can just do it at home. Dr. Coley, talk a little bit more about the risk factors for developing diabetes and the benefits to doing a screening like the one 9Health's offering at home.
So I think Liberty kind of highlighted the major risk factors. I'll just expand a little bit on what she said. So certain ethnicities, we know that Latin or Hispanic ethnicities tend to have a higher predisposition. South Asians also tend to have a higher predisposition to developing type 2 diabetes. And then age, of course, is a big risk factor. Alcohol use is emerging as a risk factor primarily because of the increased caloric intake and such associated with alcohol use. Sedentary behaviors, not exercising, There's some data as well about the distribution of fat on your body. So not just being overweight, but are you more of an apple shaped where you have kind of fat all over, or are you more of a pear shaped where you hold on to fat more in more central areas, with those having certain different types of profiles. So there is also scientific evidence saying that even those who are pre-diabetic have a higher risk of heart disease. So even before you cross that threshold, which for hemoglobin A1C is 6.5%, even if you're in that 5.7 to 6.4% range, you are technically considered maybe on the spectrum of having a higher risk. So it is a risk continuum, and it's not like it's suddenly going to go up if you have diabetes, and it doesn't mean anything if you have pre-diabetes. Every incremental increase in your hemoglobin A1C can potentially confer more risk. So I think checking it is, as you have pointed out, is really the most important part of being aware of it. How often you should check it really depends a little bit on your age, on your underlying risk factors, on your family history, and whether or not you've had an abnormal hemoglobin A1C in the past. So for most of my patients who are sort of middle-aged, have some risk factors, I try to check it at least once a year for just screening purposes. And then if it comes back abnormal, or we institute some lifestyle changes and then we want to see, how it responded, then I check it more frequently. Between checks, you want to wait at least 3 months because it's the average blood glucose over the past 3 months. So if I check it today and I check it again in 6 weeks and it's still high, it may not tell me too much because it hasn't given it enough time to change. So you want to wait for it to get to that new steady state. And personally, as I heard Liberty talking, I had a question for her as well, which is, I have a ton of patients with pre-diabetes, and I talk to them in the office about lifestyle changes, but how do I refer them to you? Can they self-refer themselves? Do you accept insurance? What types of paperwork and cost implications are there for a diabetes program like this?
Those are great questions. They can self-refer to the program by just calling the YMCA and inquiring about the diabetes prevention program. And right now, there are several insurances that cover the program, such as Medicare. And we do have grant funding right now for the YMCA's diabetes prevention program to cover the cost if your insurance doesn't cover it, if you're underinsured, or you have no insurance. So we do have different modalities to pay for this program. So virtually anyone who has gone through the program has paid nothing out of pocket because we make sure that it's accessible for everyone.
That's incredible. That's lovely to hear. So you're going to be getting a lot of my patients calling you next week.
That sounds great. Thank you.
And we did have a question about cost, so thank you for addressing that, Liberty, and for asking that, Dr. Foley. For the screenings through 9Health, 9Health at home, that screening is $50. If you go to Quest Patient Service Center, it's $35 to get the hemoglobin A1C screening. I'm scrolling through comments, just trying to see what else I can ask you guys right now. So, people are talking about just the complications of having type 2 diabetes. Someone said, their brother was 58, wasn't taking their insulin, obese, ended up passing away. Someone talked about kidney failure. Dr. Clay, I don't know if you can just add to that, but just the complications if you do have type 2 diabetes, the health complications you might encounter.
So let's talk about why diabetes causes these complications in other organs. So if you think about it, you have extra sugar in your blood, and your blood is circulating through all your organs, all the blood vessels, big and small. And what that extra sugar does is it's really toxic to the wall of the blood vessel. So it causes what we call endothelial damage, which is damage to the wall of the blood vessel. And it can directly affect the wall of the blood vessel, but it can also cause secondary changes, like it can make the cholesterol that's swimming around in your bloodstream more likely to stick. So that is the mechanism by which it damages your organs. So if you talk about heart disease, it basically damages the walls of the blood vessels around the heart that supply oxygen to the heart, and then it makes the cholesterol stick better because of that damage. And so you start to develop blockages. The same thing happens in your neck here with risk of stroke. The same types of changes can actually happen in the small blood vessels in your eyes. So people can have what's called retinopathy, which, in the late stage of diabetes can actually lead to blindness or, damage to the ability to see because it damages your retina. The same thing can happen in your nerves. It can damage the blood vessels going to the small nerves in the legs and the hands. So you can get a pins and needles sensation happening all the time in the advanced stages of diabetes, and that's called a neuropathy. It can damage the blood vessels to the kidneys, and that's how it causes nephropathy or kidney damage. So you can really see that diabetes is not just a disease of sugar or a disease of the pancreas, it's really a disease of the entire body. And the other implication that it has by causing this damage to the blood vessels is it causes accelerated aging of your blood vessels. We call that accelerated vascular aging. So if you look at a diabetic's blood vessels compared to a non-diabetic's blood vessels, if the two people are the exact same biological age, the diabetic's blood vessels are going to look as if they were 10 or 20 years older. So it's accelerated aging of their blood vessels. So as we've talked about, it's such a systemic disease that has so many longstanding implications. But what's great about it, especially type 2 diabetes, is that it's reversible in the early stages. And even if you're somebody who already has diabetes, instituting many of these lifestyle changes can improve your hemoglobin A1C to the point where you can come down on medications. Or I even have a couple of diabetic patients who completely gotten off of their medications because they lost a lot of weight, made a lot of healthy lifestyle changes, and their hemoglobin A1C came down nicely. So even though they're diabetic, they really didn't need to be on any of those, blood sugar type of medications. So really take this disease seriously, because I think it has such a profound impact. And the incidence in the United States is so high, primarily because obesity here is so high. So it is something I think that we can change the course of.
Liberty, I wanted to ask you, just with the pandemic and things going on, talk a little bit more about how that has changed the program. Are people still signing up for it? Have you seen either a drop in participants or an uptick in participants?
Yeah, with everything going on, there has been a shift in our programming. So we are mostly offering online delivery of the diabetes prevention program and all our other health initiative programs that we offer at the YMCA. And that's just because people are not comfortable coming in person and attending these small group meetings, even though we can space out and adhere to regulations. So we've listened and we've been given the okay by CDC to deliver this program virtually. So right now we're starting a virtual cohort of the diabetes prevention program in mid-September on Tuesdays from 5:30 to 6:30 p.m. So it's been great.
And Dr. Coley, I was just curious too, with the patients that you've had, you talked about referring some of them to the diabetes prevention program. Are you seeing more patients with complications or pre-diabetes right now? Just at the beginning of the pandemic, we were telling people to not worry about their preventive health as much, stay at home, don't go to the doctor. And now we want them to kind of get back in the habit of having those preventive screenings. What are you seeing amongst your patients?
I am seeing an uptake. So if someone comes to see me once a year because of their heart, last year they maybe weren't pre-diabetic, but this year they've gained a little bit of weight, and you check that blood sugar, the hemoglobin A1C, and that tends to be a little bit higher. So I am definitely seeing a slight increase in the incidence of pre-diabetics. Thankfully, the diabetics that I have, they're continuing to sort of stay reasonably well controlled because they're staying compliant with their medications. But I wanted to hear from Liberty a little bit about what are some of the lifestyle changes that you're recommending. There's so many, and it's so hard to know where to start. A lot of patients ask me about diet. What should they be eating? What should they not be eating? And I'm always telling them that you have to count the salt, you have to count the sugar, you have to count the fat. And so how does one keep it straight and know what they can eat?
In the program, we really focus on having food as fuel. So we don't really look at those calorie components on an individual level. We make sure that we emphasize how we need to vary the food that we eat. So there's a limit to everything. And if you take it in small steps, then you can start to pay attention to those other things like your salt intake, your fat intake, what types of fat you're intaking into your body. So we take it step by step, and we do have program goals to prevent type 2 diabetes, such as losing some of that weight, around 7%, which is 10 to 15 pounds, roughly, depending on the person, and achieving those 150 minutes of physical activity per week. So those are the overall goals. And the way we do that is through healthy eating, and that can look very different from person to person, and just making sure that the activity is suitable for that individual. So
Yeah, I was gonna ask, do you come up with nutrition lists for each person kind of thing? Is that part of the benefit of the program? Like what someone should
a
eat and not eat?
little. They come up with their own, and we're sort of the guiding force. But people know what's best for them, and they just need that guiding force and those tools and support to make sure that they're adhering to their goals and the program goals as well.
Great, and I put a link to the YMCA of Metro Denver, their diabetes prevention program. More information on that, I put a link in the comments. Also a link to sign up for screenings through 9Health. So we are offering screenings at home. You can do a hemoglobin A1C screening from the comfort of your own home, or go to a Quest Patient Service Center and do it there as well. And I think that's really all I have for you guys today. I'm looking at the comments to see if there's anything else that we can address. Before we go, I also want to remind everyone that you can still call our 9Health Neighbors line if you have any health question about diabetes, COVID-19, really anything. That number is 303-698-4455, extension 2005. Leave a message and a 9Health medical volunteer will call you back within 24 hours. Again, just a way we're using some of our volunteers since we didn't get to have those spring 9Health fairs. But I want to thank both these ladies for joining me. And if you have any additional questions, you can put those in the comments and I'll pass them along to them later. Thanks so much.